Hello everybody, I'm James Crabtree and our Chair of the Health and Medicines Committee has nominated myself to give you an update to our virtual meeting which was held on the 16th of February 2022. So, standing items as always, antimicrobials and antihelminthics. With respect to antimicrobials, BEVA have been moving forward in consultation with RCVS Knowledge, and there is an RCVS Knowledge Steering Group meeting happening shortly, which Tim Mayer will be attending. We've been working quite closely with RCVS Knowledge. We've been assisting them in communications with some of the practice management systems and contributing our practice data back to RCVS Knowledge to sort of enable them to get an insight into how equine practice and prescribing and dispensing practices and policies sort of work, and what data would be useful for us to get back out to the system. BEVA are keen to keep a hand in with the RCVS Knowledge with respect to antimicrobial resistance and antimicrobial usage, and we're working very hard with everybody in the industry to sort of make sure that we help guide the information that is generated from that program. With regard to that also, we had an update that AAEP is starting to think about a working group on antimicrobial use and resistance, which is very positive. Europe and North America have often had differing views with regard to the development of antimicrobial resistance and antimicrobial use. So it's nice that some of the things that we're talking about are extending to our colleagues in North America as well. On the subject of antihelminthics, the committee discussed Project Worms, which is a joint CVS and vet partners led initiative looking into factors that might develop or contribute to worm resistance, and BEVA are looking to support that, and hopefully that's something that can be extended to other members and groups within our profession. There is an antihelminthic resistance working group which has progressed fairly successfully thus far to raise antihelminthic resistance issues, and we're looking for BEVA to continue with this. There's also been approach from other membership authorities from South Africa about BEVA perhaps contributing or sharing some of its knowledge with them, and so that's a strategy that is ongoing. Some of the new matters that were arising, we were looking at import regulations and certificates. It's something we're all very familiar with, export regulations and export certification procedures, but BEVA are contributing to the discussion on what should form part of the import system, as currently no horses require, or registered horses don't require any health screening coming in, despite all horses going out requiring some. So that's something that the Health and Medicines Committee are considering and working with. There is also consideration for the development of an equine infectious diseases working group, which will contribute to BEVA knowledge, and BEVA will contribute to as well and offer guidance to its membership. Bouncing back and linking back a little bit is the SQP, the Suitably Qualified Persons Consultation, which really from the equine point of view only really applies to antihelminthics, but BEVA's recent highlighting of certain advertising strategies by companies to sell cheap wormers and SQP involvement is really important, and we've questioned the standard of SQP prescribing and also the standard of our own veterinary prescribing as well. So it's something BEVA are taking very seriously and will be contributing to make sure that the SQPs prescribing antihelminthics for equine clients are at the highest level and appropriate for purpose. Other things, we discussed the introduction of new client information leaflets, which have made them onto the website, which is good. And also, we're trying to progressively review the website, review the content that we've already got there. And it might not be unsurprising to some of you, but may be surprising to some of you, how much information is actually on the BEVA website. There is a lot of information out there. We're trying to make it as accessible as possible, but it is some very useful information from a range of things, from guidance practice standards information, and other useful resources as well, including links to antimicrobial and drug data sheet searches and product data sheet searches. So that's another useful resource which is on there, which not a lot of people would know about. Next meeting would be in another quarter. We'll continue working hard to make sure that we're representing the views of everybody. Thank you.